Hoy, en un episodio más de Hablemos de Cáncer, les tengo una eminencia en el tema, lo más top a nivel mundial. Es un honor para mí tener la oportunidad de entrevistar a quien asesora a la monarquía británica en temas médicos relacionados a las enfermedades que han padecido los dos miembros de la familia real, la princesa Kate y el rey Carlos. Se conectará desde Inglaterra el nombrado médico del año por la revista Hospital Doctor y oncólogo del año por la Asociación Británica de Oncología. El profesor Robert Thomas es especialista en cáncer, con 30 años de experiencia en atención al paciente, oncólogo consultor en los hospitales Edinburgh y Bedford en Inglaterra, profesor visitante en la Universidad de Cranfield y profesor clínico en la Universidad de Cambridge. Es autor del libro Lifestyle After Cancer. Presidente del Comité Asesor de Expertos en Ejercicio de Macmillan Cancer Support y editor del sitio web sobre estilo de vida y cáncer, cancernet.co.uk. Dirige una unidad de investigación activa que ha diseñado varios estudios en el Reino Unido. Ha publicado 75 artículos científicos y ha presentado más de 100 resúmenes en conferencias internacionales. Es miembro editorial del Comité Nacional de Investigación sobre Terapia Complementaria para la Investigación del Cáncer y del Comité Nacional de Supervivencia, entre muchísimos otros estudios académicos y experiencias laborales. La entrevista del día de hoy será en inglés y estará subtitulada para mayor comprensión. Welcome to the podcast Let's Talk About Cancer, Professor Robert Thomas. Okay, so let's start, Professor Thomas, with the first question. You have studied a lot about lifestyle and cancer. Could you please describe what a healthy lifestyle is?
Okay, well, that's a very broad question you're asking. I mean, if you want the answer to that, it's going to take 4 hours, okay? So, anyway, a bit about myself. I'm an oncologist, so I treat people with chemotherapy, radiotherapy, biological treatments, hormones, okay? And what we do is create a lot of side effects and a lot of problems for patients. We help them as well, and it became very obvious for me over the last 20 years that people who help themselves, they eat well, they exercise, they do all the other healthy things, they have less side effects, they respond better to treatments, and when they finish the treatments, the chance of cancer coming back is less. So that's why I got into it, so that I know that's not the answer to your question. But, you know, you have to look at every individual patient and say, we need to improve their well-being. So you can't say generally, these are the 20 things we should all do. You need to look at the individual and say, okay, you need to improve your exercise, or maybe you're a little bit overweight, maybe you're vitamin D deficient, maybe you don't eat fruit and veg. So there's no complete answer, I'm sorry to say that, for everyone. You have to look at the individual.
Yeah, definitely. I have been reading your book, and I know. It's a lot of information, and there's a lot of different things that people can do. But well, more or less, I would like to know, is it a reality that cancer can be prevented? Is there any evidence of it?
Oh, absolutely. There's a very good organization in Britain called the Cancer Research UK, and they look at all the data from around the world, and they publish. And I wrote about this last week, in fact. About 10 years ago, they said probably 30% of cancers could be prevented through lifestyle. Now they've changed that to 50% of cancers could be prevented by a healthy lifestyle. You know, all the usual things, not smoking, exercising, not being overweight, etc. I think it's even higher. I think it's probably approaching 60-70%, but you know, and those trials are evolving. So yes, we can definitely prevent cancer. Not everyone, you know, some people can lead a perfect lifestyle and still get cancer. But also the same evidence applies to after you've had your cancer. The Princess of Wales, recently, you know, she had cancer in Kate Middleton in the UK. She did a really nice video, and at the end of it, she said, I'm going to now look at my lifestyle and I'm going to do things to prevent this cancer coming back. And that was a great message for the public.
Yes, definitely. And what about are there any programs to prevent cancer in the UK, and what do they consist of?
Good question. There's not many formal programs to prevent cancer. We always have, most of the time people present to their doctor with an illness, and then you try to correct the illness and maybe rehabilitate them afterwards. Obviously in schools we're trying to tell people to, exercise more and eat better, which helps not just cancer but lots of illness. But I wouldn't say there's a formal program to prevent cancer.
Okay, but what you're sharing with us about the Princess of Wales, it's a good way to prevent cancer, because if she's saying I have it and I'm doing this, I'm changing my lifestyle, that's a very good thing that they're doing, but not formal programs.
No, I mean, formal programs are more linked to screening. So, for example, mammograms and bowel screening and skin screening, cervical screening. It's more about picking up cancers earlier. It's very hard to. I mean, I've as Jose from Mexico, I've met a few times, pointed out, most of my trials are involving people who've had cancer diagnosed. When you start doing preventative studies, that's very, very difficult. Most of the studies looking at lifestyle and dietary factors which prevent cancer are more observational. So you would say, look, these people aren't overweight, or these people don't smoke, or these people eat more tomatoes or whatever, and they don't get cancer. There's not many prospective, so you'd give people an intervention. So you're right. It's an area which needs to be expanded going forward.
And according to your data and all the research you have been doing, what about the percentage of the genetic heritage? How many would you say, like more or less, what percentage is genetics and what percentage is lifestyle?
Well, as I said before, it's about 50-50.
Oh, 50-50.
Yeah, about 50-50, but I that's the official figures. I think it's more. For example, I wrote a paper a couple of weeks ago about diabetes, in fact, not about, I know I'm digressing. And people say, my dad had diabetes, my uncle had diabetes, so, it's in the family, it's whatever. And, this really good study showed that it was actually something like 95% of people who had type 2 diabetes was because of the lifestyle choices they made, not because of their genetics. So yes, of course, if you've got genes which are susceptible for cancer, like Angelina Jolie had the BRCA1, BRCA2 genes, you are going to have an increased risk. But if you have a healthy lifestyle, that cancer is going to be later in life, and it's going to be a less aggressive form. So, lifestyle and diet is the most important thing when it comes to cancer.
Okay, and I know you have studied the effects of polyphenols to prevent cancer. Can you tell us what polyphenols are, in what foods we can find them, and what scientific evidence regarding their benefits in cancer and prevention?
Well, fortunately, coming from Mexico, you have lots of polyphenols in your diet. You have lots of chili, herbs and spices. And I love when you go to a pub in Mexico, you get given different salsas. Those are things which have got lots of color, taste and smell. And the chemicals which do that are called phytochemicals, of which polyphenols are the biggest group. And they have enormous health benefits. They act as prebiotics, so they help your gut health. They reduce inflammation in your body. They can directly reduce proliferation of cancer cells, and that's why populations who eat more polyphenols or phytochemicals have a lower risk of cancer, and after cancer you have a lower risk of it coming back. So I say to my patients, look, the one thing you need, I say lots of things, but one of the many things you need to do is ramp up the polyphenols. Make sure you have lots of herbs, spices, nuts, fruits, vegetables, because that is going to have a big impact on your health. And there's lots of evidence for that. We did a trial 13 years ago now, where we made a capsule with like polyphenol rich foods. We gave it to men with prostate cancer, and we saw a significant reduction in the rate of progression of cancer. And that became a supplement called POMI-T. We've now recently done a further study where we added other foods to it, like ginger and cranberries, and we gave it to men with prostate cancer. And the beauty of that, and that's why I love doing lifestyle research. I do lots of mainstream research as well of drugs. We have a big research unit, so I'm not saying I only do lifestyle research, but the research I enjoy most is the lifestyle research. And that showed a 30% reduction in urinary symptoms, erectile function improved, and PSA reduced. So we know that these foods are anti-cancer.
Okay, yes, we have in Mexico one called Jamaica, that it's a flower and it's full of polyphenols, and we have also, we use tea, green tea, and there's a lot of polyphenols, of course. And what about that? You have also studied the effect of the microbiome in people with cancer. Tell me about your experience in the management of probiotics in people with cancer. I understand that you also conducted a clinical trial, so if you can share us more information about microbiome and cancer, will be great.
This is a really emerging topic. If you watch this space over the next 10 years, this is going to be very influential. And it's driven by, I don't want to say there's a conspiracy theory here, but when the big pharma, we're moving away from chemotherapy now, okay, because we're moving into biological treatments, and which is the future of oncology. So for the breast cancer patients I treat, I will give some chemotherapy, but most of the benefits to come from drugs which get them to recruit their own immunity to recognize the cancer as foreign and attack it. Okay, so therefore you're asking, you and I have a good immunity. Mm-hmm. And what's the best way to improve our immunity is to improve gut health. And now we're showing that when you give these drugs like PD-L1 inhibitors or pembrolizumab, people who have a poor gut health do not get benefit from these drugs. People who have a good gut health get 40 or 50% increased benefit. So suddenly the drug companies are realizing that if you can get people to have a better gut health, they are going to respond better to their drugs, which is of course great, but they're going to make billions more profits. So if you go to big organizations like ASCO now in Chicago and San Francisco, which I'm going to in February, the drug companies are behind this. They know that gut health is going to be the key to helping people. So it's now emerging as one of the most important things you can do to help yourself. So good question.
And it will be great to listen to you. How can we improve microbiome?
Well, I'm sure you know this already because you're obviously a well-known person in Mexico, but everyone's different, but you need to do things to prevent your damaging. So processed sugar, sedentary lifestyle, smoking, too much alcohol. All the usual things. Kimchi, do you have kimchi in Mexico?
Yes, we have chucrut, kimchi, kefir. We have a lot of probiotics. Fermented foods.
Fermented foods, yeah. So definitely, you need more fermented foods. Now, as a scientist, we're thinking, okay, when you design a double-blind randomized trial, it's very hard to say this group should eat more kimchi and kefir and all these, and this group should have like a standard diet. So you have to then think, well, how can we boost the amount of bacteria in the diet? And that's with probiotics. So, and it's a good way in a scientific evaluation to improve that person's probiotic intake. So we use probiotics, and we did a large COVID study. I don't know if that was well known in Mexico, that we showed that if you give people with COVID probiotics, especially with vitamin D and prebiotics, they had a much quicker recovery and less side effects, not just in the gut, but less breathing problems. So we were the first research group to show that. So we were quite keen on probiotics, to be honest. And then recently it became known that people with prostate cancer, for example, when they have a poor gut health, they're more likely to progress faster. Not only get prostate cancer in the first place, but some people, men with prostate cancer, you can just watch for a while before needing to treat. And those people with a poor gut health progress faster. So we then worked with a couple of organizations, including Stacey Kenfield from California, and said, look, well, maybe we could improve men's gut health and reduce the rate of progression. So we did a double-blind randomized trial. We gave them a probiotic called GOT Plus, or Your Gut Plus, depending on what country, which is mainly lactobacillus, but it's got vitamin D and inulin. And it was 50-50 randomization. And it's just finished, actually. We got 220 people. It was very well recruited. And it was a great trial to be part of because, we're looking at markers of prostate cancer, but along the line, people are going, my arthritis is better. My indigestion is better. I'm clearer. So it's lovely to give an intervention which has other benefits. When you give a drug, they usually moan about the side effects. But when you give probiotics, they just reward you from the benefits. And we saw a clear reduction in PSA. In fact, this is going to be the first trial to show that an intervention to improve your gut health could reduce the progression of prostate cancer progression, which is, and again, we're very proud of that. And we were very proud of Mexico to be one of the first countries to embrace that probiotic to take it on board sort of commercially.
That's great. Definitely it makes sense because you're using symbiotics. You're using prebiotics like acid, inulin, probiotics, and also postbiotics as vitamin D. So everything makes sense that it really improves other parts of our life and health.
Well, I think you and I are on the same page. So we're not surprised about the data.
Well, yeah, of course.
But I presented this yesterday in Newcastle in the UK. It was a big conference, and they were people who were sympathetic to lifestyle like yourselves, but they were staggered by the magnitude of benefit. And I think when we present it in San Francisco in February, it's going to be in front of just mainstream, boring doctors wearing grey suits who just think that everything is about the drug and not about the lifestyle. They're gonna be shocked when they see this data.
Okay, let me ask you something. In fact, I have a company a scientific company where we analyze microbiome. That's why, and I have a lot of scientists. I'm just the wellness communication and entrepreneur, but they are the scientists. And we know that we need to eat fiber, we have to eat fermented foods, prebiotics, and a lot of different colors, polyphenols, as you were saying. What else? Something that it blow out your mind that you said, this is something very, very new. I want to share this because it's something people haven't heard about it.
No, that's very admirable. Well done. I mean, I think you need to identify people with poor gut health. And that's what you're doing by the sounds of it. People say, well, what is the probiotic? Well, what bacteria should we give people? We're not going to develop a probiotic we can give this person or that person. I mean, you're doing tests, so presumably you can see deficiencies in people's. So of course that would make sense. So you individualize. So you give them, if they're short of acidophilus, I can never say the names of these things. Then you give them that. But it's all about. And this is what in the scientific committee for the trial, we said, look, we just need to shift the balance from the pro-inflammatory bacteria to the anti-inflammatory bacteria. You just need to shift it. And you can do that with, just with prebiotics probably, or reducing the sugar, or stopping smoking, or exercising. So, I don't think it'll be a wonder pill we can give every single person. So, but it's what you're doing. In Britain, there's a thing called the Zoe app, and they're identifying, what you're doing is identifying their poor gut health as an issue for them, and that's brilliant.
Okay. Very good. Well, let's talk about amino acids. We just talked about microbiome. Let's talk about amino acids. So, okay, what about the consumption of essential amino acids? Are they helpful?
I'm glad you asked that, because I'm actually a professor of sports science as well as an oncologist. So most of my clients, I mean, I have 50-50. I have patients who have cancer and I have elite sportsmen. And it's surprising, you need to eat more protein than you think, especially if you want to have an active lifestyle. And, a lot of people don't surprisingly eat as much protein as you think. So they turn to meat as a very good protein source. But of course, meat has other negatives, notwithstanding the influence on our environment. But if you cook meat, you've got nitrous amines, which are carcinogenic. They increase the risk of cancer. So, I'm normally saying you should go for the natural product. But when it comes to protein, I think, products which have the essential mineral acids, such as mus forte and others, where they just have the essential mineral acids, there's a big role for them. For example, today I did a park run. I did 10K at 8 o'clock in the morning. I played tennis in the afternoon. I don't want to have a steak for lunch, so I will have an amino acid shake, because I know that's going to give me the amino acids which my muscles need to get that rapid recovery, because I'm playing tennis against tomorrow. So you need, if people who are actively looking to improve their physical training, I would say yes. Instead of turning to meat, you should have supplements which contain amino acids. So I'm actually all for it.
Okay, and talking about this, there's a lot of people that it's saying, or a lot of research about a plant-based diet to prevent or to cure cancer, but other people are saying no, you need a lot of protein because of the chemotherapy, the treatments, or like to get to recover better, you need protein. What do you think about these two ways of thinking?
No, I totally agree. I think a lot of patients are protein deficient. There is a well, look, when you treat cancer, I treat lots of cancer patients. Most of them are just having adjuvant chemotherapy. They're just they will go back to a normal life and they will be cured. And in those patients, their diet isn't good, so they maybe don't feel like eating too many protein-rich foods. And I would say, a protein supplement is good. Then you get the other end of the spectrum, people who are dying of cancer, they have cachexia. And we know that if you start losing muscle bulk, that's a very poor prognostic sign. So whatever stage of cancer you are, I think you should be improving your amino acid intake, combined with exercise. And some supplements have shown to be harmful, ones with lots of sugar and things like that. But just an amino acid boost, I think, is a really good idea.
Okay, so it ends up in balance.
Exactly. And at the end of the day, if you take an amino acid drink, your body's a wonderful thing. You're not gonna get an excess of protein. It's not like fat. You will just you pass it out in your urine, or you will want to absorb it. So you're not going to do it yourself any harm by taking excess essential amino acids. But you will be doing your body harm if you don't have the building blocks when you need to build up your body after a treatment.
Why people that are in remission relapse? Anything that you can do to avoid it?
Well, absolutely. I mean, this is what I do. I'm an oncologist, and this is what I tell people every day. And they ask, what can I do to reduce side effects? What can I do to reduce the chance of cancer coming back? And I don't want to harp on about it, but I really respected Kate Middleton, the Princess of Wales, who said, I'm now going to spend time looking at things to reduce my cancer coming back. I think she had ovarian cancer. We're not entirely sure. And she went through quite toxic chemotherapy, so fair play. and she emphasized that we can do things. There's a significant reduction in cancer relapse. For example, if you exercise 3 hours a week, if you make sure you're not vitamin D deficient, if you have plenty of polyphenols or phytochemicals in your diet, and you have good gut health. Now, those things, and you think, oh, he's just talking nonsense. No, if you look at the trials, these are giving you 30 or 40% reduction in your cancer coming back. I give chemotherapy to patients, and if I can get a 10% reduction, I'd be happy. So it's the lifestyle factors are actually giving you more chance of your cancer coming back than the treatments from the oncologist.
Yeah, and also for the princess and any other person that has cancer, also the stress management.
Now that's more difficult. That's a good question. And I believe you, but the data is very difficult to interpret on stress, because we need a little bit of stress because it's going to get you to get up in the morning, go for a run, and perform well in your job and stuff like that. But obviously too much stress will lead to a bad mood and depression. We know if you're depressed after cancer treatments, you have a higher relapse rate. There was a very good study from San Francisco which looked at men with prostate cancer, and those who were depressed had a higher relapse rate. So psychological well-being is very important, but it's an emerging field, and I'm glad you brought it up. And if you know more than me, that I would love to learn from you. But I think the general rule is you need to stop depression. Anxiety is different. I think a little bit of anxiety is good.
Okay. Why do you say that? It's interesting, that point of view.
Because if people encourage them to go out for a run, it gets them to focus their mind to go and change their lifestyle. Whereas if you're depressed, you tend to you do the opposite. You tend to sit back, sit on the sofa, you feel sorry for yourself, you don't. So I think it's depression is the problem. Obviously too much anxiety is bad, I mean, I get that, but it's depression is the problem. Low mood and depression, and low mood will give you fatigue, it'll give you cognitive problems, so your thought processes aren't as good, and the motivation to lead a healthy lifestyle is a lot worse if you have a low mood or depressed. Whereas if you're slightly anxious, it's usually the other way. You're usually more motivated to go and help yourself.
Yeah, I understand your point of view. You're talking about hormesis versus chronic stress. So a little bit of dopamine, a little bit of cortisol, a little bit of adrenaline. It's gonna take us like a drive for life. But too much, maybe it's gonna get us sick.
Yeah, that's true. That's absolutely true.
Okay, but any recommendation to better manage stress in all your experience?
Well, what we look at in our oncology patients is we look at the whole spectrum. Are you sleeping? Are you exercising? Are you eating well? I mean, what symptoms are you having? How's your gut health? And it's all, it's all a circle. It's all related. So, I mean, sleep management is very important. And a lot of patients after cancer have problems with sleep. We know that 60% of patients have, they have less than 6 or 7 hours a night. They wake up in the early hours. So we did a couple of things. I mean, obviously, exercise in the morning. You trigger your body with circadian rhythm. So I always say to patients, exercise. Please, can you exercise before breakfast? Extends the overnight fast, and it triggers a circadian rhythm. Don't exercise late at night. Processed sugar. We know that processed sugars drive stress, particularly late at night. And then we did a large COVID study where we gave people some phytochemical-rich supplements and some probiotics. And one of the endpoints was not just about gut health or temperatures, was whether they were sleeping better. So the company who supplied us with the supplement rebranded the supplement as a sleeping aid, and it's called what's it called now? Phytonite. They've called it. It's not available in Mexico, so but anyway, it's a combination of like high dose chamomile, turmeric, pomegranate, resveratrol, citrus bioflavones, all the things we know naturally improve melatonin levels. So that's why I'm not really a fan of melatonin, because for short term it's okay, for long term it's not the answer. You need to naturally produce it. So I actually now point people towards this supplement called Phytonite, and it's non-sedatory. And you think, well, hang on, how can it help sleep if it's non-sedatory? But it just improves your melatonin levels, and it just gets you into a better mood. And we've had amazing results with that. So, it's a package. We sit them down, no sugar at night, exercise in the morning. If you wake up in the night, take Phytonite, improve your gut health. So it's all the package. And then if you're sleeping better, everything's better. You're more motivated. Yeah, exactly. Come on, we all know a good night's sleep is nice, isn't it?
Definitely, yes. The first and most important thing in life.
Exactly.
Very nice, doctor. What advice can you give us so that a person with cancer has good nutrition?
Okay, so there's different, that's a broad question, because, you could have men with early prostate cancer who have no symptoms whatsoever. And for them, I am first and foremost a phytochemical rich diet: turmeric, green tea, chili, herbs, spices, nuts, all those things. And if they want to take a supplement, the latest supplement is called Your Phyto, which took over from Pommy Tea, but either of those are okay. So, those are the things you need, because that's where the evidence is. If you have more advanced cancer, I would say look at things to improve your gut health, reduce processed sugar, increase your essential amino acids. But, don't just look at meat. Look at, quinoa, lentils, or maybe a supplement such as Mus Forte. Vitamin D. In Britain, we have a big problem with vitamin D deficiency, and we know that people who are low in vitamin D, their cancer grows faster. Maybe not so much. I don't know. So is in Mexico, is it a problem, vitamin D deficiency?
Yes, and it's a genetic problem, definitely. But I understand that in UK you have less hours of sunlight, so that should worsen the situation. But yes, in Mexico too.
People can avoid the sun, so those are the key elements.
But do you agree with some sunlight every day?
Yeah, absolutely. If you can get sun, for the first hour of the morning, that's the most important thing.
Okay. And well, you were telling us that you really exercise a lot. So you're an athlete. But for the rest of the people, many times due to activities or space, it is difficult to exercise. But what exercise recommendation will you give us?
I just came back from a big conference in the UK, and they were saying, it's very difficult. As you said, it's very difficult for a lot of people to exercise. Doesn't seem to influence weight reduction that much. Although I disagree, but anyway, the data suggests it's not as good as you think. I would say what we do, we link with the local university. So all my patients, after they see me, I send them to the university and they put into a formal program. There's a private radiotherapy provider in the UK called Genesis Care. And we've built now gyms next to the radiotherapy units. So when they go for their radiotherapy, they go to the gym first for half an hour. They have a trainer, and then they have their treatment. And they may have 6 weeks of radiotherapy. So they've had 6 weeks of training. Most of them then carry on with exercise afterwards because they love it. But it's that initial step. It's getting people who've never exercised to exercise is the problem. And, we have lots of community gyms where you can refer people for a formal program. I'm not sure if you got that in Mexico. But, in the private sector in UK, we've managed to introduce exercise programs. In the NHS, which is the vast majority, we need to start building gyms next to cancer units. because you can't say to someone, "Oh, go for a jog in the park, go do some yoga classes before breakfast," because they might do it for 2 weeks and then they will give up. You need to take them physically to the units, and then once they get into it, then it usually perpetuates. So, but it is one of the most important things, I would have to say.
Okay, and well, there's a lot of things to talk. Like there's a topic that I'm very interested on it, and it's about fasting. What about fasting in people that has cancer, and what about fasting before the treatments?
Yeah, that's a growing question. I mean, I'll tell you the evidence for cancer and breast cancer. There's a very good trial from Copenhagen in Denmark, where women who had breast cancer, who were a little bit overweight, and they said, look, just fast overnight, have your evening meal at 8 o'clock in the evening or earlier, and you fast 13 hours overnight, and then you have your breakfast. Not a big deal. I mean, most of us aren't eating in the middle of the night, are we? The people who managed 13 hours had a 30% reduction in breast cancer relapse 5 years later. They had lower levels of hemoglobin A1C, which is a marker of diabetes, and they had lower inflammatory markers. So that simple process of fasting overnight had significant benefits. So people say, "Oh, I need to fast all day." No, just have your evening meal a bit earlier. Don't snack in the evening. Have your breakfast a bit later.
But you mean 12 hours or a little bit more?
Well, funny enough, in the trial, 13 hours seemed to be the golden duration. Less than that, they didn't seem to have a benefit. I think it's a bit subjective, but so that would be the simplest way to fast. Just fast every day at night. Just don't snack until you go to bed, and also in the morning, if you can exercise even for 10 minutes or 20 minutes when you get out of bed, you're extending the fast. Not just by the 20 minutes, but physiologically, you're extending it by 2 or 3 hours because it's the same mechanism. So that, to me, that's what I advise people. Don't do all these fast 5-2, 6-3, 16-2, all these sort of thing. The other component of your question is before chemotherapy. And now, the court is still out. We don't know the answer to that. I would definitely say to people, don't have a big meal before chemo. And there's centers in Phoenix, Arizona, which are looking at people fasting or even putting people on treadmills doing the chemotherapy. And you know what? I think it's a good area to look at. I don't think the evidence is quite there yet.
Okay. I'm very excited to talk with you, but we have to end up this podcast. So I would love to ask you a last question. Could you please share with us a message for the people that has cancer?
Look, well, clearly it's a devastating thing for you. And, some people are going to progress. Doesn't matter what you do. You have to rely on the main treatment. They're getting better all the time. But you do have some ability to dictate your future. It may be to reduce side effects, improve your well-being, and in some patients, to significantly reduce the risk of progression and relapse. So just do it. Just, look at the evidence, look at your podcast, look at the other things you're talking about. You have some control.